Headlines is presented by Calvo's Insurance, a legacy of trust, serving Micronesia since 1938. Matson, celebrating 25 years of commitment to Guam, Micronesia, and the CNMI. Cars Plus Hyundai, home of the Kona electric vehicle, an electric heart with an SUV soul. Test drive yours today at Cars Plus. McDonald's of Guam, I'm loving it, and King's Restaurant, serving your local breakfast, lunch, and dinner favorites for over 45 years.
As senators debate money for DOC coming up, we head behind bars and give you a tour of the Mangilao compound. And KUAM Behind the Front Line will give you part 2 of our close-up look at Ground Hero at the Guam Memorial Hospital. Plus, starting today, FEMA officially took over operations at the Infusion Center in Mangilao. These stories and more ahead on Guam's News Leader.
Hafa and good evening. Corrections officials have finally completed a detailed master plan for a new prison. They say it'll fix many of the problems that have plagued DOC for years. Now they need the money to build it, and senators discussed the bill today to do just that. Nestor Lecanto reports.
Major Anton Uggan knows all too well about the severe challenges of running an overcrowded, grossly outdated facility. Speaking on the link, the nearly 30-year veteran of the Corrections Department believes it's time for senators to finally put their money where their mouths are.
Every year, we're going to be asked the same questions. Why is overtime so high? Why is your officers leaving? Why is there contraband? Why is there fighting? Why are they stabbing each other? Why aren't you separating them? It's going to be a repeat. It's like insanity, doing the same thing over and over and expecting different results. Senators will be saying, aren't you following policy? Aren't you following policy? If I go by policy, we need 350 officers to run a less than 600 population. That's just crazy. But it's because we have 18 housing units and all the sections are spread out. All the directors that have come here kept saying same thing. We need a new facility, and they just keep kicking it down the street.
Senator Joe San Augustine's bill would put an end to the kicking.
This bill aligns with DOC's master plan to construct a new state-of-the-art prison. Also, the construction of a new prison will ensure that all federal standards, such as the National Prison Standards and the Prison Rape Elimination Act, together with local standards, will be met by the agency.
A leaseback deal will be negotiated to be paid back annually using $5 million from EITC reimbursements.
Colleagues, it is our duty to ensure our people are provided for, whether they are liberated or not. It is simply just and right for the Department of Corrections to have a modernized infrastructure that upholds security of inmates and detainees, as well as rehabilitative service to equip them with life and work tools so they may thrive once they are reintegrated into the community.
The proposed high-rise, high-tech prison will offer greater security and require less manpower to operate. For Guam's News Network, I'm Nestor Lecanto.
As of late this afternoon, senators were still deliberating on the Department of Corrections Modernization Act of 2021. It's expected to be passed on to the voting file along with the Medical Center bill, which was moved earlier. Session reconvenes next week. From the debate on the session floor, we now head over to the Department of Corrections, where our Tyler Matanani took a tour of the Mangilao compound. Tyler?
Tomas, one word can describe the conditions here: deplorable. DOC officers and staff work here 24/7, 365 days a year in a facility that's falling apart at the seams.
It's a prison, yes, but as DOC Major Anton Uggan defends, the inmates, no matter how heinous the crime, are still human beings.
When you treat people in a condition like we have them housed now, when they get released, what are we releasing? Are we releasing better people? People that you want to stand next to at the store? Or are we going to be releasing hardcore criminals with very sympathy for human life because of the way they've been treated?
During our tour of the Mangilao compound, we visited several different posts, and each one was in shambles.
In the cells, there's some leaking coming through the wall, and also around their toilet bowls, and some toilet bowls don't flush properly.
Many of the units don't have cameras, and the ones that do,
These only see the front door of each cubicle. It doesn't go in the block. We didn't have enough funding to put more cameras inside.
the absence of locks, the inability to properly monitor inmates, poor infrastructure, and old control panels aren't even half of the improvements needed in DOC's master plan. This all has made the job for officers and staff much harder than it already is.
This is unsafe. Okay? Staff don't feel safe working in this facility because our systems are not there.
With all these risks, what keeps DOC employees here?
They love what they do, right? But it's for that same that stay, there's a lot more that leave.
What we've shown you barely scratches the surface of the structural problems here at the Mangilao compound. You can read their comprehensive master plan outlining all of their deficiencies on our website. Reporting for Guam's News Network, I'm Tyler Matsanani. Back to you in studio.
Thank you, Tyler. Also from the Department of Corrections on the link, this morning DOC confirmed 29 prisoners had tested positive for COVID-19. According to Major Anton Ugin, 11 should be cleared today, while the remaining 18 will remain in active isolation. Almost all of the prisoners were vaccinated except for 4. In part 2 of our Behind the Frontline series, healthcare workers talk about the practice of proning during COVID-19. It's all a part of the standard of care. Here's more.
Proning has been shown in non-COVID patients to be very beneficial. I even tell this to my families and friends who test positive in the community to lay on your bellies.
It's all hands on deck for healthcare workers at the Guam Memorial Hospital.
Proning is literally laying on your belly. And that allows the lungs to open up.
And they use every practice in the book.
We use all of our staff. We maximize every movement in that room. It is everybody's responsibility to go in and assist the patients.
She says the data shows proning and medication decreases the ICU level of care and intubations. Nurses focus on letting patients understand the importance of proning.
The moment they're diagnosed with COVID, they're immediately told to start proning because it does help with getting air into your lungs and helping to open up the lungs more.
Patients can breathe easier, and perhaps frontliners too.
It's a whole multidisciplinary team working to get these patients better and out of the hospital.
And Guam officially rolled out the booster shots to eligible island residents. Our Hannah Devanzo brings us the story from the UOG Calvo Fieldhouse.
All 600 slots were booked for the booster shot, and Maggie Diego was one of those able to make an appointment for today.
I have an underlying health. I had a heart attack in 2013, and I believe that having this third booster shot might be an answer for me, so I can live longer for my kids and my grandkids.
The Pfizer booster is only for those who meet the criteria. These include individuals who are 65 years and older, those with underlying health conditions, or those at high risk, such as frontline workers. People will also need to have completed their initial doses 6 months prior. Guam National Guard spokesperson Captain Mark Scott says today's clinic may have been full, but there will be plenty of other opportunities.
Please make an appointment. I think everyone knows the website. It's Eventbrite. The URL is tinyurl.com/VaxGuam. It's what kind of meters out the crowd so that we don't have everyone come all at once. It lessens your waiting time. So if you're able to get vaccinated, if you choose to get vaccinated, please go online, make your appointment, and we hope to see you.
Agena Heights Mayor Paul McDonald was also one of the hundreds to get their booster shot today, and for good reason.
Because I would like to protect myself and others that I work with. And, as I do my job, I meet a lot of the residents, and I'd like everybody to be safe.
Reporting for Guam's News Network, I'm Hannah Devanzo.
FEMA has boots on the ground providing much-needed assistance to the Infusion Center located in Mangilao. In an exclusive interview with KUAM's Daniel Perez, they speak about the island's COVID situation and how it's compared to the continental U.S.
FEMA contracted nurses Karen Bodie and Shirlita Nelson are no strangers when it comes to the COVID battle. While Bodie was in Pennsylvania saving the lives of those dealing with the virus, Nelson was in New Orleans giving COVID tests to cruise passengers. Now both are here in an effort to help with the monoclonal antibody treatment.
The officials here seem to be doing a really good job with control and treatment and getting the vaccines out. I learned in one of the meetings that we're over 70% vaccinated here, and we're testing like 1.9% of the population every day, and that's amazing.
You're much higher in Guam as far as vaccination rate than we are in the States.
Nelson struggled when dealing with COVID for the first time.
One experience I have, I was at the Navajo Reservation for the first 6 months of the pandemic. So I was the ILI, which is infectious disease coordinator. So we pretty much was on the ground figuring out the treatment for COVID, the symptoms, and how we were going to take care of the patients there.
Bodie acknowledges the significant differences from the COVID situation in the mainland and Guam.
Everything is different here. I mean, they're on top of everything. Like when you go to restaurants, you're showing your card. You know, they're making sure you're not close in proximity to each other. In the States, they put everybody side by side.
Yeah.
So that's what's different here. They're making it very serious about COVID, and it makes me happy.
With the job comes risk, but they continue to fight the virus despite knowing the danger that it poses.
I've been a nurse for over 30 years, and that's what I took my oath to do. If I can save one person's life, it's a blessing to me. I love this field. I don't care if I'm in danger. I do it because I love it.
And I do it because I love helping people, and I want to make a difference during this horrible pandemic.
Since arriving 6 days ago, they have been working nonstop at the Infusion Center. After seeing the COVID situation here firsthand, they gave this message for the people of Guam.
Keep on coming out, get tested. If you're positive, we're here to help you.
Get tested, get the treatment needed, come and get the monoclonal antibodies if you need it. It really helps, and people see a big difference after getting the treatment.
Daniel Perez reporting for Guam News Network.
Heading up the FEMA team at the Infusion Center is Dr. William Palmer. He'll be overseeing the FEMA contractors and has had almost a year of experience administering the monoclonal antibody treatment.
In my private practice, yes, I've been doing these since November. So we've only been doing IV infusions, but like even last week, I had 5 patients that tested positive that I ended up treating with the monoclonal antibodies, and they had good outcomes.
From the mission.
Dr. Palmer takes charge in Manila from Dr. Luis Cruz, who continues to encourage island residents who test positive for COVID-19 and are eligible to get the treatment.
So people are aware, people are asking for the treatment, the clinics are aware, they're referring their patients. So it's steadily getting there, and we hope hope to treat more patients that need this treatment.
The treatment is administered through a shot followed by a 1-hour monitoring period. The Infusion Center is open Monday through Saturday from 9 a.m. to 5 p.m. Stick around for more news here on Primetime. You're watching KUAM.
Get up-to-the-minute news, plus access to alerts, streaming radio, promotions, and more on your mobile device by downloading the KUAM News mobile app, available at the App Store now.
My name is Keith Iglesias. They're always preaching college in school, which is, if you want to do that, that's fine. But I'm always talking to the young men and women in school right now, these kids, and telling them, if you don't have something, look up the trades, because there's always going to be construction needed. We have 2 apprentices enrolled with our company right now. Some of my friends that are still in high school, I'm always telling them, look to do something. If I was in high school, I definitely would have chosen this kind of path, but I didn't know at the time.
Don't need a work break, keep the smile on your face. The moments you can't replace, and I'll be around. Whoa. You can count on me. You can count on me for life.
Wherever life takes you, we're always here for you. Calvo's Insurance. Count on us for life.
And instant prizes from Foot Locker and Burger King. Win the best-selling 2021 Toyota Corolla LE, the crossover SUV 2021 Toyota RAV4 LE, and the dynamic luxury SUV 2021 BMW X1. The more you shop, the more chance to win. In the Micronesia Malls, shop and win.
When making the new Kentucky Fried Chicken sandwich, people asked how I felt about burger places selling fried chicken. I'd say that's none of my business. Just like making fried chicken is none of theirs. Get the new Kentucky Fried Chicken sandwich. It's finger-licking good.
It's a special delivery to your inbox every week with your KUAM News Roundup, program advisories, and promotions. Sign up for the weekly KUAM Digital Digest today on KUAM.com.
Today was the deadline for all of Guam schools to submit their plans to DPHSS on how they will begin random COVID-19 testing on campus. KUAM's Isaiah Uggan has more.
All schools were required to submit a COVID-19 screening testing plan to the Department of Public Health and Social Services by today as an added layered COVID mitigation effort. According to Public Health guidance, the plan must have a goal of randomly testing 10% of the student population in the first 90 days of implementation. Guam Department of Education Interim Public Information Officer Michelle Franquez confirmed this afternoon that their testing plan has been submitted to Public Health. She says that most of the plan is still being looked at.
No, the plan has been submitted. Our plan has been submitted today. The first part, like I said, phase 1, which is dealing with unvaccinated employees, has been approved. Currently, the next phase, which is dealing with just surveillance of symptomatic students and employees, is still under review.
As we reported, 115 GDOE employees have been trained to administer the Abbott Rapid Binax test. All 41 public schools have a designated nurse, which means on average, each school will have at least 3 staff total administering the test. GDOE received some COVID test kits recently but needs more. Superintendent John Fernandez of GDOE assures stakeholders they won't be implementing the testing plan immediately. He plans to present the plan to stakeholders first. Reporting for Guam's News Network, Wahusi Isaiah Uggan.
The Guam Department of Education has reported that there are still about 800 students unaccounted for. In early September, GDOE reported about 1,000 students haven't shown up to classes, either online or in person, since the start of the school year. Through home visits, GDOE Deputy Superintendent of Operations Erica Cruz pointed out that the number of students that have not shown up to classes has slightly dropped.
We're looking at 864. Those numbers have decreased within the last 2 weeks. During the remote learning time, our SROs and our social workers have been deployed to do home visits to find out what we can do to assist them. I should be able to give you clearer numbers as far as how many students we were able to track down. I know the first week we were able to reach out to at least 200 students, or the first week and a half we were able to reach out to at least 200 students, and we're still chipping away with those numbers.
KUAM News Archive shows that in October of last year, there were nearly 3,000 unaccounted students. And a 49-year-old man who was charged with 2 counts of second-degree criminal sexual conduct. According to court documents, an 11-year-old female indicated to Guam police officers that she was inappropriately touched by Derek John Mafnas Santos, and on 2 occasions over the course of 2 weeks. The victim stated to police that Santos would come into her room while she was asleep. She remained still out of fear. After the second incident, she told someone who lived with her Santos was booked and confined. October 3 to October 9 is Fire Prevention Week. This year's theme is Learn the Sounds of Fire Safety. Various stakeholders came together virtually to commemorate the week, which will focus on educating the public about smoke and carbon monoxide alarms and the importance of creating an escape plan for family in case of a fire. This year's committee chair is Lieutenant Philip Ennis from the Guam Fire Department.
Let us reflect on the past to know what Fire Prevention Week means. And let us look to the future to see what Fire Prevention Week can bring.
Throughout the week, there will be several events to include a billboard contest among fire stations, video skits, and a proclamation signing at Andersen Air Force Base. The month of October was also proclaimed Red Ribbon Month. This year's theme is Drug-Free Looks Like Me. District Court of Guam Chief Judge Francis Tidinko Gatewood.
The main purpose of the Red Ribbon campaign is to present a unified and visible commitment towards the creation of a drug-free Guam, of a drug-free America. As we kick off the 2021 Red Ribbon campaign on Guam, let us continue with our education outreach to the children and our community. And let's keep the tradition of wearing and displaying our red ribbons as a symbol of intolerance towards the use of drugs nationwide.
Red Ribbon Month is an event held across the country. It was started in honor of DEA Special Agent Kiki Camarena, who was killed by drug traffickers in 1985. Sports is up next, and still to come, your Cold Stone Creamery birthday shoutouts.
your community calendars, brought to you by Taco Bell. Whether it's your first meal or your fourth meal, we've got you covered. Taco Bell, live Mas.
New crispy almond chicken breast. For a limited time, only at Panda Express.
You are everything that matters to me, and I promise to do whatever it takes to keep you healthy, to be comfortable, and to be free. I love you. As long as we're together, I'll always make sure that home will always be our best place to breathe.
"100% truck."